Ladies and gentlemen, welcome to the Wellness Show. On our episode tonight, we are going to talk on matters nutrition. As we always say on programs and subsequent programs, is that our slogan is be good, feel good, look good. Our episode today is all about nutrition, and we are privileged to have a nutritional expert who is also in Kidney Foundation in this country, and her name is Banda. Karibu sana, Madam Jean.
Thank you.
More about yourself.
My name is Banda.
Yes.
I'm a clinical nutritionist.
Clinical nutritionist.
Yeah,
Yes.
and an educationist.
Educationist.
Yes, and I also focus a lot on community programs
Okay.
that are related to health.
Yes.
So let's say community health.
Community health.
Yeah.
Okay. They say we are what we eat. Tell us more about food and our lifestyle.
Yeah, that's a good question.
Yes.
Especially today when you find that people are so busy.
Yes.
One thing that's important is that we need to have at least 3 decent meals a day.
3 decent meals a day.
Breakfast,
Yes.
lunch,
Yes.
and dinner.
Which one? Okay, yeah.
Now the catch is this. They all have to be balanced. So breakfast must be a balanced diet, lunch, and dinner as well. What do I mean by balanced diet? It means we must have carbohydrates, proteins, and vitamins. The vitamins and minerals are also very crucial if our bodies are to function optimally. Yeah, so that's very, very important. In between, some people like to do snacks. But we have to be very careful about the kind of snacks we take. Because if you take the wrong snacks, you'll definitely add weight, which is not going to be healthy. By eating a balanced diet, I assume you're trying to be healthy. But if you start having unhealthy snacks in between, then the balanced meal is going to be futile. Yeah. So healthy snacks would include things like probably salads. You could have a carrot stick. You could have fruits. And I also think drinking a lot of water is important. Yeah.
What about now, since we are all busy, the lifestyle has become, people are just too busy, and like personally, I do restaurants most of the time. Is it good?
That would be tricky because sometimes you might find that the foods have additives, the foods may be oily, and in that case it is very important to go through the menu, and when you're not sure, you must ask what the meal entails. I would think it's safe to go by grilled foods, baked foods, as opposed to deep fried foods if you're eating out, the way you say. So if you have your grilled chicken, you have your salad, you have a little bit of carbohydrates, then you're good to go. Yeah.
What about the people with conditions like diabetes? What would you advise them on the foods that they should take?
For diabetics, they need to take small meals at regular intervals. They also need to watch their carbohydrate intake. This is because they're not able to produce enough insulin to counter the carbohydrates, which have been broken down to simple sugars. They need to avoid things that are high in sugars. That means sodas are out, juices, especially those ones that have been sweetened with sugar or sugar products. And life should not cease to be fun just because you're a diabetic. You can eat, but just watch your portions. Concentrate more on the vegetables and proteins as opposed to the carbohydrates. Yeah.
When it comes to weight loss, as you know, weight loss is a problem that Kenyans and actually people worldwide are suffering from. It has become a condition. Could you give us an insight on the kind of foods that we could eat to maintain our weight, or rather to have the weight that we deserve and that is not having other conditions?
Yeah, there's no quick fix.
There's no quick fix.
It's a journey.
It's a journey.
It requires commitment,
Yes.
and one must really be focused. because it's so easy to just drop off because you feel you're not losing the weight as fast as you want to. And it's also not healthy to go for the fad diets, you know. It's good to go slowly and do it the healthy way. That means you must eat healthy and you must also incorporate an exercise regime. Yeah, and of course avoid things that are sweet. You know, now chocolates will be out. I know, imagine, eh? Yeah, yeah. Valentine's is around the corner, but now go slow on your chocolates. Go slow on your cakes. And if you really have to do the cake, why not go for a plain one and just a slice? I'm not saying deny yourself totally, but seriously, watch your portions. And even if you watch the portions and you want to take it every day, I'm not so sure we're going to make headway. So you can tell yourself that once a week, I'm going to have that slice of cake and enjoy it. But you can't have it every day, even if it's a little. You need to be strict on that. You need to incorporate exercising. It doesn't have to be vigorous. You can even just walk. Walking is actually a very good exercise. And also, if you live in a building that has stairs, why use the elevator all the time? Or if your offices have stairs, use the stairs, especially going up, you know. That should really assist towards the weight loss. But food is crucial. I'd say it's 80% what you eat.
Yeah, 80%
Yes. Yeah, so it doesn't matter how much you exercise, if you're eating wrong and taking in a lot of calories, it's not going to work, you're not going to see results.
What are the best foods for our skin type, for our skin?
Actually, your skin can also tell your health status. When your body is too acidic, that's when you find that you'll have all the rashes and, you know, that kind of thing. So number one, water. Water is a cleanser. Drink lots of water, about 2 liters in a day. It can even be better if you have the warm water with lemon early in the morning before you take anything. So wait for half an hour and eat a lot of vegetables, fruits. Go slow on the fruits because remember the fruits are going to finally be broken down into simple sugars. They have what we call fructose, which in itself is a simple sugar. So if you take a lot of fruits and you're on a diet, you're actually not helping yourself. So take some fruits, it's very important. Drink lots of water. Eat a lot of vegetables, high fiber food. Don't forget to make sure that your meals are balanced. So despite the salads, also have a little bit of carbohydrates, some proteins, and most importantly, don't forget to walk because it's going to help with the circulation. If you're able to afford swimming, it would be good. Swimming is one of the best exercises, yeah, because it works out the whole body. This will also increase the circulation of blood. That means the oxygen is really flowing very well throughout your whole body. The gym is also equally good, but for people with conditions, it is always good to seek your doctor's advice first before you go into the intense workout of the gym.
Well, you are also the founder of the Kenya Kidney Program in this country. Could you tell us more about the Kidney Foundation?
Okay, once the kidneys fail, it means your body is not able to clear out the toxins, the breakdown of the foods. When it accumulates in the body, say proteins, you'll find that there's a lot of urea in your blood. You're going to experience things like itchy skin. You can also not take a lot of water because one of the functions of the kidney is to excrete the excess water. That means that a patient whose kidneys have failed will definitely have to watch their protein intake, their fluid intake. Fluid means that's not just water, it's not just the juices, it's not the porridge, every single thing in a day. And this is determined by the amount of urine the patient is able to remove at that point in time. Because you find as the disease progresses and advances, then for some of the patients, they're not even able to urinate. So in that case, these ones are only allowed about half a liter of fluid in 24 hours. That includes soup, because if you're taking rice, you're going to add soup, and soup is liquid. you know. So the diet is really, really, really strict, and it is a challenge. It takes a lot. It really does take a lot, and these patients also need a lot of moral support. Then potassium levels. So much as you can take a lot of fruits, any other person will be able to. For the kidney patients, the potassium is very dangerous, and potassium is found mainly in green leafy vegetables and the fruits. So they must go slow on that. There's some fruits that they cannot take at all, for example, bananas. Other things which are considered healthy and they can't take are avocados. So sometimes you find that somebody is unwell, and the first thing you tell them, eat a lot of fruits, drink a lot of water. And imagine telling that to a kidney patient
So a kidney patient is not supposed to take.
on dialysis, whose kidneys have failed,
Yes.
and they're now undergoing dialysis because the kidney is now not able to execute its duties. Yeah, it cannot remove the potassium from the blood, the broken down proteins, the fluid that the person has taken. Yeah, so at the end of it all, their diet is a strict one. Yeah.
What about cancer?
Yes, cancer is also another condition. The numbers are increasing.
They're really increasing.
For cancer patients, again, acidic foods are also not very good. I don't want to give a blanket solution because each case is different.
Each case
You'll
is
find
different,
that just like with kidney patients, they also experience low blood levels. Now, the kind of supplement a kidney patient needs is not the one a cancer patient will need.
Yes.
Because for the kidney patient, the kidney excretes most of these things, and in their case it cannot, then the supplement they require is going to be different from a cancer patient whose kidneys are working.
Yes.
Yeah, but you see the thing is they both have low HBs, that is the low blood level.
Yeah.
So the cancer patient, for optimum functioning, also needs to be on a diet. It has to be a healthy diet, but basically what I would say is this: for almost all patients, they need to reduce the fat intake. That also means, like for milk, whole milk may also be a bit too much for them.
Okay.
Whereas the cancer patient will be encouraged to drink a lot of water, the kidney patient will be told, no, go slow. The end-stage kidney patient, I want to be clear, end-stage kidney failure patient, because, it also comes in stages. There's stage 1, stage 2, stage 3, stage 4. So when you're at the end and the machine is now doing the work, you really need to be very strict with your diet for the kidney patients. Yeah.
What about HIV patients? What kind of foods would you advise them to consume?
They need to eat a balanced diet. They need to nourish the bodies. They need to take a lot of water. Because you see, once you're on medication, any sick patient will need that water to cleanse their system.
Yes.
They need to exercise. Exercise helps with circulation. And when the blood is flowing well and there's a lot of circulation, especially like when the heart rate increases, you find that the patient also feels much better, So exercising is also very crucial for all sick people.
Exercise.
Exercise, the fluid intake, except for some conditions, like we said, end-stage kidney failure. And that's why we cannot give a blanket cover. It's actually a very personalized service. Yeah.
Well, you've heard from Banda how we need to eat and what we need to eat, and especially people with different conditions. Food, whatever we eat, is very important. We'll be right back after the break.